They won't tell you this at your regular doctor's visit, but let me be blunt. If you've stopped masturbating in your later years, your body might already be breaking down, and you probably don't even know it. No, this isn't some taboo topic or locker room nonsense. This is real clinical physiological truth, and the consequences of ignoring it can be devastating, not just to your sexual health, but to your brain, your heart, your sleep, your immune system, and even your sense of self. My name is Dr. Mohit Kara. I'm a urologist and men's health specialist with over 30 years of experience working with aging patients across the country. I've spent my career studying how the body changes as we grow older, especially when it comes to intimacy, hormones, and long-term vitality. And one of the biggest silent threats I've seen: too many older adults abandon their sexual health, and with it, a major key to their overall well-being. Here's what may surprise you. Masturbation isn't just a leftover impulse from your younger years. It's actually one of the most powerful tools your aging body still has to regulate your hormones, boost your brain, protect your prostate, even fight off depression. And if you've stopped or never started, the price you're paying might be far higher than you think. In the next few moments, I'm going to walk you through exactly what happens inside your body when you stop masturbating in old age. What I share may completely change how you look at your health. They won't tell you this at your regular doctor's visit, but let me be blunt. If you've stopped masturbating in your later years, your body might already be breaking down, and you probably don't even know it. No, this isn't some taboo topic or locker room nonsense. This is real, clinical, physiological truth, and the consequences of ignoring it can be devastating, not just to your sexual health, but to your brain, your heart, your sleep, your immune system, and even your sense of self. My name is Dr. Mohit Kara. I'm a urologist and men's health specialist with over 30 years of experience working with aging patients across the country. I've spent my career studying how the body changes as we grow older, especially when it comes to intimacy, hormones, and long-term vitality. And one of the biggest silent threats I've seen: too many older adults abandon their sexual health, and with it, a major key to their overall well-being. Here's what may surprise you. Masturbation isn't just a leftover impulse from your younger years. It's actually one of the most powerful tools your aging body still has to regulate your hormones, boost your brain, protect your prostate, fight off depression. And if you've stopped or never started, the price you're paying might be far higher than you think. 1. Decreased prostate health and urinary function. When I first began practicing urology over 3 decades ago, I didn't expect so many of my patients to open up about something so private, yet so critical to their health: the quiet disappearance of sexual habits in their later years. One man I remember clearly sat across from me and said, "Doc, I just figured I didn't need that part of life anymore." He was in his early 70s, fit, sharp, but he'd been waking up 4 or 5 times a night just to use the bathroom, and he couldn't understand why. What he didn't know, and what most men don't realize, is that regular ejaculation, even through masturbation, plays a crucial role in keeping the prostate functioning properly. The prostate isn't just some passive gland sitting in the body. It's a living, dynamic organ. It produces fluid, expands and contracts, and like any system, it suffers when neglected. Without regular stimulation and release, prostate fluid can stagnate. That stagnation creates the perfect environment for inflammation, swelling, and eventually the kind of pressure that disrupts everything from urination to sexual performance. You might feel it as a heavier bladder, a weaker stream, an uncomfortable sense of fullness that won't go away. These aren't just annoyances, they're early warnings, And here's the dangerous part. Chronic prostate congestion can quietly escalate into more serious conditions like benign prostatic hyperplasia, BPH, which affects nearly 50% of men over 60. Left unchecked, it can lead to urinary retention, bladder infections, and even the need for catheterization. That same man I mentioned, he eventually needed surgery to relieve the pressure, something that, had we addressed earlier through simple, consistent habits, might have been avoided. The science is clear. Regular ejaculation helps flush out the prostate, clear out old fluid, and reduce the risk of buildup. In fact, studies have shown that men who ejaculate 21 times or more a month are significantly less likely to develop prostate cancer than those who don't. And let me be very clear, this isn't about a return to youth or some kind of obsessive behaviour. This is not about fantasy, it's about function. It's about using your biology to protect your body in the simplest, most natural way possible. When you stop masturbating in old age, you're not just ignoring pleasure, you're risking pain, inflammation, and a gradual loss of control over one of the most basic human functions, urination. I've had patients who've become afraid to leave their homes because they don't trust their bladder. I've seen strong, proud men reduced to sleepless nights and daytime anxiety over a condition that might have been managed or prevented with something as simple as regular self-stimulation. And yes, there's a mental toll as well. Losing control of your body in this way, needing to map out bathroom breaks, dreading long car rides, waking every 2 hours at night, it eats at your sense of independence. It's not just about your prostate, it's about your freedom, pelvic floor and circulation. When intimacy disappears, Isa, weakened pelvic floor and blood circulation. Several years ago, I treated a retired firefighter in his 70s, a proud, physically strong man for most of his life. He came to me complaining of mild urinary leakage and difficulty standing for long periods without discomfort in his lower back and hips. "It's strange," he said. "I feel like the foundation of my body is slowly giving out." What he was describing wasn't just aging, it was the slow, quiet weakening of his pelvic floor. And he wasn't alone. The pelvic floor is a group of muscles at the base of your core, the very ones that support your bladder, bowel, and sexual organs. Most people don't think about these muscles until something goes wrong: urine leakage, constipation, erectile dysfunction, or discomfort when standing or walking. But here's the part that's often ignored. Regular sexual stimulation, including masturbation, plays a major role in keeping those muscles active and engaged. You see, during arousal and orgasm, the pelvic floor contracts rhythmically. That contraction is a workout, not for vanity, but for function. It improves blood flow to the lower body, strengthens the internal support system, and keeps the nerves and muscles communicating effectively. It's not about performance, it's about preservation. When you stop masturbating regularly, those muscles don't just go quiet, they begin to atrophy. Blood flow slows down, tissue becomes less elastic, nerve response fades, and eventually you may find yourself struggling with symptoms you never expected: frequent urges to urinate, slight dribbling after using the bathroom, difficulty holding gas pain during movement. For men, this can mean a dramatic drop in sexual function. For women, it can lead to dryness, tension, and discomfort that discourages all intimacy. I've seen once independent adults begin avoiding social outings simply because they don't trust their bladder. I've seen others become embarrassed about sudden leaks when coughing or sneezing, not knowing that this all traces back to something they've neglected for years: circulation and muscle activity in the pelvic region. And here's something I need to say clearly. Ignoring this area isn't just inconvenient. It can lead to falls, incontinence, and a loss of dignity that no one deserves. You might start relying on pads, special undergarments, or bathroom proximity planning, all because the base of your body isn't getting the stimulation and support it needs. And the longer it goes on, the harder it becomes to reverse. What breaks my heart is how many people suffer in silence. They don't talk about it. They feel ashamed, confused, or assume it's just part of growing older. But I can't stress this enough. Your body still wants to function, even at 70, 80, or beyond. And one of the most effective natural ways to support it, without medication or equipment, is through safe, regular, intimate stimulation. When you reclaim that connection, you're not just activating pleasure, you're restoring strength. You're sending blood where it's needed most, waking up nerves, keeping tissues alive, and reminding your lower body that it still matters. But as physical as this consequence is, the next one goes even deeper, inside your immune system, your cellular defenses, and your body's ability to protect you from illness. Because what happens inside your bloodstream after orgasm might just be one of the most important and most overlooked health advantages of all. Let's talk about how sexual inactivity could be quietly weakening your immunity. 6. Lower immune function. A few winters ago, one of my longtime patients, a man in his late 60s who'd always been relatively healthy, came in looking drained. He'd been sick 3 times that season with lingering colds and low-grade infections.
I used to bounce back in a day or two, he told me. Now, every little bug knocks me out for weeks. When we ruled out the usual suspects, diet, sleep, medication, I gently asked about another area of his life. Have you been sexually active at all, even alone? He smiled uncomfortably, then shook his head. Nah, not for a long time. That part of me is just retired. What he didn't realize, and what most people don't, is that sexual activity, including masturbation, has a direct impact on the immune system. That's not a metaphor, it's biology. During sexual arousal, and especially orgasm, your body produces a surge of biochemicals. Not just dopamine and oxytocin, which make you feel good, but actual immune-enhancing agents. Immunoglobulin A, IgA, for example, rises significantly. This is a key antibody that helps defend your body against viruses, bacteria, and infections, especially in the respiratory and digestive systems. Endorphins are also released, reducing inflammation and supporting healing. Now imagine going without that boost, not just for a week, but for months or years. Your body starts to lose one of its easiest, most natural defenses in a time of life when your immune system is already slowing down. Taking away this mechanism is like pulling the batteries from your smoke detector. You might not notice at first, but when trouble hits, your body won't respond like it used to. I've seen this play out in real time. Patients who've shut down their intimate lives often find themselves getting sick more frequently, recovering more slowly, experiencing flare-ups of chronic inflammation. And while they may not connect the dots, their body is sending a clear signal. Something's missing, and it's not just about fighting off the flu. The immune system is deeply tied to long-term disease prevention, cancer surveillance, cardiovascular protection, even wound healing. Regular sexual release helps maintain hormonal balance, reduce stress hormones like cortisol, and increase circulation, all of which are crucial for maintaining immunity. When that disappears, the domino effect begins. Stress increases, sleep suffers, inflammation rises, and your body becomes a slower, weaker version of what it once was. One woman in her 70s, after losing her husband, told me she hadn't touched herself in nearly 5 years. When we talked honestly about the connection between sexual activity and immune strength, she decided to try reconnecting with that part of herself again. Not for desire, but for wellness. Months later, she returned with brighter eyes and more energy. I can't explain it, she said, but I just feel more alive, like my body is working with me again, not against me. That's not magic. That's what happens when the body gets the signals it needs. Signals that say, we're still here, we still want to thrive. It's easy to overlook or dismiss or feel awkward about, but your immune system doesn't care about shame. It only responds to action. And sexual stimulation, even solo, is a powerful action, one that sends a message of life and strength through every cell in your body. But while lowered immunity may expose your body to disease, the final consequence of neglecting self-intimacy might cut even deeper into your very sense of identity. Because when you stop touching your body, you may slowly stop recognizing who you are. Let's explore how self-neglect can quietly erode your self-worth and what you can do to reclaim it. 7. Loss of body ownership and self-worth. I'll never forget a quiet conversation I had with a patient in his late 70s. He was a retired school principal, once confident, quick-witted, the kind of man who used to command a room. But when he came in for a routine checkup, something in his posture had changed. Shoulders slightly hunched, eyes a little dimmer. As we talked, he sighed and said, "I don't really feel like I live in this body anymore. I feel like I'm just inhabiting it." That sentence stayed with me because what he described isn't uncommon. I've heard it from both men and women, in different words, but with the same underlying truth. Somewhere along the way, they stopped feeling at home in their own skin. And too often it starts with silence, with giving up self-intimacy, brushing it off as no longer necessary, too late in life, or something I've outgrown. But here's what really happens when you stop touching your body. When you stop paying attention to it in that deeply personal way, you begin to disconnect from it, slowly, quietly, and sometimes permanently. Self-touch isn't just about pleasure, it's about presence. When you stimulate your body, even gently, even with no goal other than to feel, you remind your nervous system that you are still here, that you matter, that your body is still part of your identity, not just a vessel you're waiting to leave behind. Without that, something changes. A kind of emotional and psychological distance forms. It becomes easier to ignore small aches, easier to stop looking in the mirror, easier to believe that this chapter of life isn't worth nurturing. And that is the most dangerous loss of all, the loss of your own sense of worth. I've seen this disconnection lead to deep emotional numbness, shame about aging, a withdrawal from physical affection, a loss of motivation for basic self-care. People stop exercising, eating well, dressing with intention. Why bother, they think, when this body no longer feels like it belongs to me? One woman told me she hadn't touched herself since menopause. "I just stopped feeling like a woman," she said. "And the less I touched myself, the more I disappeared." That word, disappeared, hit hard. Because that's exactly what happens for many older adults who stop engaging with their physical selves. They don't just lose pleasure, they lose identity, visibility, a sense of aliveness. And here's the part I need you to hear. It doesn't have to be this way. Reclaiming your body through self-touch isn't about being sexual in the way you were at 20. It's about honoring the life still present in you. It's about saying, "I'm still here. I still feel. I still deserve to be seen, even by myself." When you reconnect with your body, even in the privacy of your own home, you begin to reverse that quiet erasure. You remind yourself that aging is not vanishing, that your worth didn't expire with your youth. You come home to yourself again. And that, perhaps, is the most healing act of all.